Hello, my name's Dr. Jeannie Knapp, and I'm a GP working in Richmond. I've been working in Richmond for 15 years, and prior to that came from New Zealand. I'm one of the practice owners there, and I also have the pleasure of working at the PHN, and I've been asked to do a webinar on carer awareness in general practice. The webinar is in three parts, and the first part is recognising the carer role. So we're just going to think about who are carers to start with. And amazingly, 1 in 8 people in Australia are carers. And that, just for context, if we think as a practice that we want to identify patients in our practice with certain health conditions, 1 in 8 is significantly more than the people in our practice who have both diabetes and asthma, which are conditions that we would all quite routinely recognise in our practice, record and be aware of. So the 1 in 8 people works out to be 2.6 million Australians, and they might be caring for a family member or a friend, and people become carers in many different ways. People can become carers gradually as a person's health and independence get worse over time, or it might happen suddenly after a health crisis or an accident. Many carers feel it is what they should do, and they don't really have a choice. And it's important not to confuse carers with paid care workers, such as community or aged care workers. Again, who is a carer? And as I said, sometimes that can happen gradually, and sometimes that can happen suddenly. Many people don't identify with the term carer. There may be other words that they use to describe themselves. Some people dislike the label carer, believing it distracts from their identity as a parent, as a child, as a partner, a relative or a friend for the person they care for. A carer provides care to another person, and the Victorian Carers Recognition Act of 2012 defines a carer as someone who provides care to another person and includes carers under the age of 18. Carers might provide care for a person who has a disability, has a mental illness, has an ongoing medical condition, or is an older person with care needs. And carers don't need to live with the person they care for. They don't need to be the main source of care and support. And they don't have to provide care every day or over many years, or receive carers payments in order to be a carer. There's different types of ways that someone might be cared for. Someone might be provided with continuous care, or some other carers might have more intermittent care roles. Continuous care can be providing up to 24 hours of support, and it might be aiding someone with high care needs, helping with daily activities such as preparing meals, bathing, dressing, toileting, moving around, or taking medicines. Others might have more intermittent care roles, such as looking after people who are mostly independent but might need help with tasks such as banking, transport, shopping, or housework. So how might we identify some carers in our practice? We've said earlier that the percentage of carers was probably higher than the percentage of people with diabetes. We might include some questions on our registration form. Questions such as, do you rely on someone for your care? Does someone rely on you for their care? Or do you assist someone who has health, disability, or age-related support needs? Particularly consider your patients who are frail and elderly, have dementia, a mental illness, a disability, a chronic illness, or complex needs, or receive palliative care. Identify if they have a family member or friend who is providing unpaid care and support. The time of the diagnosis or first appointment of patients with a longer term illness is a good opportunity to ask who their main support person is, even if they do not yet identify as needing a carer. Can you utilise your practice management software or other information systems to promote the identification of carers? And make sure you record that someone is a carer in both the patient and the carer's file. Remember that many people don't identify with the term carer, so ask open-ended questions about the things that they do and the support they provide. For example, what sort of things do you do for the person? Other questions that may help identify carers include, do you worry about leaving so-and-so at home alone? Do your responsibilities at home mean you often miss out on doing other things you enjoy or would like to do? Have you given up work or reduced your hours so you can give more support to someone at home? Do you regularly arrange hospital and other appointments, provide transport, or help someone manage their affairs so they can maintain their independence? Carer may change over a patient's lifetime, and remember that every carer situation is different. As before, some people provide care all the time, others more intermittently, and a person may be a carer for multiple people or from getting care for multiple people. What are some of the issues faced by carers? There are many rewards experienced by those caring for a family member or friend, but caring can be very demanding and often restricts the lives of individual carers and their families. Many carers miss out on important life opportunities, particularly for paid work, a career, or education. Caring can take the freedom and spontaneity out of life. There can be physical, mental health, and well-being impacts of being a carer. Caring can be emotionally taxing and physically draining. On the Australian Unity Wellbeing Index, carers had the lowest wellbeing of any large group. Carers often ignore their own health and are 40% more likely to suffer from a chronic health condition. And some health problems like back problems, anxiety, and depression can be directly related to caring. Many carers are chronically tired and desperately need to refresh with just one night of unbroken sleep, a day off, or an extended period with no caring responsibilities. There are also social impacts, including stigma, isolation, and on relationships. As many carers feel isolated, missing the social opportunities associated with work, recreation, and leisure activities. The demands of caring can leave little time for other family members or friends, and carers often have to deal with strong emotions like anger, guilt, grief, and distress that can spill into other relationships and cause conflict and frustration. It can also be financially difficult being a carer, often with diminished financial resources, having to give up work. Half of primary carers are on low incomes and find it hard to cover living expenses. The extra costs can also be large. Caring families often have to find money for extra expenses like heating, laundry, medicines, disability aids, healthcare, and transport. And not all carers live with the person they care for, and they may still need to support some of their own housing expenses. So how can we support carers in our practice? And this is bread and butter stuff for us working in general practice. This is the stuff we do with all of our patients, and we can do the same thing for carers in our patient practice. We can listen, support, and facilitate. We can use checklists or questions to help identify issues and opportunities for support. So there is, for instance, the Carer Strain Index. So in the same way we might use a checklist to help us with our diabetes patients, we can utilise a checklist to help us with providing care to carers. We can utilise the MBS to assess and manage carer health, such as health check items and mental health plan items and chronic disease items. We can encourage and enable carers to have an annual influenza vaccine as a priority group. In the same way that we safety net other conditions in our practices, we can safety net and make follow-up arrangements for carers and family members to reduce risk and improve care. We can acknowledge the significant risk of considerable psychological distress in carers and consider depression screening and referral to a psychologist or a counsellor, and we can promote carer education sessions and support groups. We can think about the financial impact of our services, and carers might be a group that those of us in private practice might consider bulk billing. We might also want to be aware of the financial impacts of referrals that we make for people who are under financial stress. As part of supporting carers, we want to value their views and acknowledge the barriers they face in providing effective support for the person they care for. Appreciate that factors affecting a carer's health may affect their ability to provide care. Also be alert to the presence of carers under 25 and provide support when a young carer is identified. Consider if they are undertaking caring duties that are inappropriate to their age. And be mindful of potential abuse. Unfortunately, both care recipients and carers may be susceptible to abuse.